Today we are going to begin a new fresh series on pharmacological side effects. For most of the students, the pharmacology would be a very terrifying subject to read for a competitive examination, but the actual truth is, in competitive examination, they are going to focus either on side effect or drug of choices. So today, I'm here to compile all the side effects in pharmacology from all the systems. Also, let us begin in a very quick manner. The first we are going to see antimicrobial side effects. In it we are going to see in the first series are antibacterial side effects. So let us begin. So the first one is cycloserine. Cycloserine causes seizures, psychosis and peripheral neuropathy, and bezitracin causes bone marrow suppression and nephrotoxicity, B for B, and vancomycin, as we all heard of the red man syndrome, and also nephrotoxicity and ototoxicity. Ototoxicity, we actually remember the aminoglycosides, right? But vancomycin also causes the ototoxicity. Penicillin Jarisch Hexmer reaction, we all heard of because of the fever and rash because of the shedding bacteria. And zone, quite commonly used in hospital setup, zone causes thrombocytopenia, pseudolithiasis and kernicterus in newborn because of the increased plasma protein binding. And there comes the beta lactam side effects. The major will be an anaphylaxis and the minor will be a rash and also hypoprothrombunemia. Because of this producing a bleeding, so prophylactic vitamin K should be administered, right? Then there causes pseudomembranous enterocolitis and then hepatotoxicity, nephrotoxicity. In nephrotoxicity especially, it causes renal tubular necrosis, right? Then what are the antibiotics safe in renal failures are ceftriaxone, cefpiramide and ceftriaxone. Fine. Then there comes the disulfiram like reaction. We all know the reaction, right? So disulfiram reaction, the drugs causing are cefmandazole, man, ceftitan, man is drinking tea, cefperazone, a person, man is a person, right? So cefmandole, ceftitan, cefperazone and oxalacetone. So these are the drugs causing disulfiram like reactions. Then there comes the polymyxin. This is contraindicated with aminoglycosides and nephro and neuromuscular toxicity also. Daptomycin, it is a drug of choice for BRSA because most of the strains nowadays are MRSA, methicillin resistant strains. For that, drug of choices are vancomycin. So again now vancomycin also got its own resistance. So BRSA producing strains have been introduced. So in drug of choice for BRSA are daptomycin. But for pneumonia is having a specific resistant producing mechanism. Because of that, in pneumonia we can't use daptomycin for BRSA resistance. We are using a linezolid. Drug of choice for BRSA in pneumonia are linezolid, right? So coming back to the daptomycin, it causes side effect myopathy, neuropathy, allergic pneumonitis, but contraindicated in pneumonia, right? I've said earlier, right? Drug of choice for linezolid in BRSA strains of pneumonia. So daptomycin side effect, myopathy, neuropathy and allergic pneumonitis. There comes the important side effects, tetracycline. Wherever I am putting these step symbol, it means it is contraindicated in pregnancy, right? So tetracyclines are contraindicated in pregnancy. Tetracyclines we are quite commonly using, like doxycycline. We are giving it for some STD infections, right? So commonly used drug tetracyclines. Nausea and vomiting is most common because there will be a non-compellence, nausea and vomiting. Then esophagitis, so therefore it producing esophagitis, we have to take a glass full of water with the doxycycline and for 30 minutes you shouldn't lie down after taking a tetracycline. Then it is a nephrotoxicity, it causes nephrotoxicity. So you can remember as TDM, the drug doesn't causing nephrotoxicity, are tigacycline, doxycycline, minocycline. Then there comes the Fanconi syndrome with the expired drugs and photosensitivity, pseudotumor cerebri, and hepatotoxic and increased calcium binding. Because of the increased calcium binding, you shouldn't take it with the milk, so it is contraindicated in pregnancy and also in children. In teeth, it causes yellow discoloration, and diabetes insipidus with democlocycline, and vestibular toxicity with minocycline and streptomycin. You can just pause, or you can even mute, or you can take a screenshot as you wish. You can study. So this is all about the tetracycline. Another important group was streptogramins. It produces injection site reactions, right? There comes another very important drugs, aminoglycosides. This is also contraindicated in pregnancy, right? So it causes ototoxicity, we know, but nephrotoxicity, this is reversible, maximum with neomycin, minimum with streptomycin. And ototoxicity, it is irreversible, maximum with kenomycin, amikacin and neomycin, maximum with auditory ototoxicity. In vestibular toxicity, maximum with streptomycin, minimum ototoxicity produced by nithromycin. right? There comes neuromuscular toxicity because of the increased effect of muscle relaxant, maximum with neomycin, minimum with tobramycin. So you have to do TDM, therapeutic drug monitoring, and this is also, as we know, teratogenic in pregnancy. And then quickly we are moving to erythromycin, very very important drug. It causes CHPS. In surgery also we read, right, congenital hypertrophic pylori stenosis, erythromycin exposure will cause CHPS. Then cholestatic jaundice, which is much more in estrolate salts. Then enzyme inhibitors, p-glycoprotein inhibitors, because of all these reactions, there is much and more drug interactions with erythromycin, and QT prolongation will be there. And we always heard of or warned of diarrhea after taking some macrolides like acetro-erythro, because it stimulates mucin receptors, that's why producing diarrhea is the most important side effect. So this is all about erythromycin. There comes the linezolid. In pediatric and all, we are using linezolid much more commonly, right? So linezolid for producing the bone marrow suppression, thrombocytopenia, so platelet monitoring is much more important, serotonin syndrome because of the MAO inhibition, and mitochondrial toxicity, because linezolid producing mitochondrial toxicity, it causes lactic acidosis, optic neuritis, and peripheral neuropathy, right? Titisolid is having a much more lesser toxicity than the linezolid, but the toxicities are same. There comes the very very important drug, clindamycin, whenever you have any acne problem, or a much more frequently used drug in the dermatology side. So clindamycin causes pseudomembranous enterocolitis, neuromuscular toxicity, and the lefamulin is again the simple contraindicated in pregnancy, QT prolongation, and increased ALT and AST, right? Then very very important drug, DNA gyrase inhibitor. We always frequently seen about cipro, levofloxacin, aldic acid, right? So the quinolones are fluoroquinolones. Important side effect is it is an inhibitor of GABA, so there will be much more stimulatory effect, seizures, hallucination, and peripheral neuropathy. The much more important side effect is tendinitis. These ciprofloxacin, levofloxacin, all are DNA gyrase inhibitors causing tendinitis. Then QT prolongation, photosensitivity, dysglycemia, hepatotoxicity, and there is DNA gyrase inhibitor. That is a simple, so it is also a contraindicated thing in pregnancy, right? So because of the phototoxicity, the sparofloxacins are banned. Because of the dysglycemia, gatifloxacin are banned. Because of the hepatotoxicity, trevoflows are banned. Then that's all about the DNA gyrase inhibitor. There comes the topical sulfonamides. It causes severe pain because it is a carbonic anhydrase inhibitor. It causes metabolic acidosis too. Sulfonamides, this is about topical sulfonamide. This is about sulfonamides. So in sulfonamides, as we all are actually, some more people are prone to develop hypersensitivity. Actually, sulfa allergy is quite common with us, right? So hypersensitivity, rash, bone marrow suppression, and Stevens-Johnson syndrome also. When we are using sulfonamides with diuretics, it causes carbonic anhydrase inhibition and sulfonylurea digoxide. So when we are using these drugs with sulfonamides, it causes SJV, Stevens-Johnson syndrome, and again it causes crystalluria, acute intermittent porphyria, methemoglobinia, kernicterus in newborn because of the increased plasma protein binding. So this is all about sulfonamides. And then trimethoprim, because it inhibits THFR, it causes megaloblastic anemia. Because it inhibits ENaC channel, it causes hypokalemia too. Then the final two drugs about methamine, GIT side effects, renal failure, liver failure with sulfonamides, which is methamine. And then the last final drug is about nitrofurantine, which is frequently used in UTI. It causes side effect of GI upset, hemolysis in G6 deficiency, peripheral neuropathy, pulmonary fibrosis. So this is all about side effects of antibacterial. Then we'll see antiviral on next series. Thank you for listening.